Cardio-Oncology is bridging a gap between cardiovascular medicine and hematology and oncology to help patients navigate high cardiovascular risk related to their cancer and cancer therapy. Patients come to our clinic either referred prior to the cancer treatment because of their cardiovascular risk, or during the cancer treatment if they have acute changes in heart function, or sometimes they are referred many years following the cancer treatment due to latent complications. Optimizing cardiovascular care leads to an improvement in the cancer outcomes, and the other way around.
In 1997, I was living in San Diego, and I had a very large tumor surrounding and wrapped around my heart. I underwent a sternotomy that actually resulted in the diagnosis of non-Hodgkin's lymphoma. My oncologists were very clear that I would most likely have long-term damage to the heart due to the chemo and radiation. When I arrived at the Cardio-Oncology clinic in 2016, I was struggling to even live a normal life.
When she came to the clinic, she was complaining of walking a few steps and developing chest pain. There are two phases in our management. The first one is to stabilize the cardiovascular disease, and the second one is to continue monitoring because of the risk of worsening cardiovascular complications. Patients are able to have in the same day their hematology or oncology appointments, as well as a cardiovascular visit.
My treatment started with testing of the echocardiograms, but even more so was the cardiac MRI, where Dr. Zaha was actually able to see the distribution of the blood supply, which we later found out was damaged due to the radiation.
She started treatment to optimize her blood pressure control and her heart function, and her symptoms subsided, and she was able to become much more active.
What I love about UT Southwestern is that we have coordinated care here. We're able to get testing here that we had not been able to access prior. And then additionally, the support services, the physical therapy that I was able to get as well. One of the things that I loved is having that option to have a virtual visit. I'm able to visit with Dr. Zaha, and I was even able to do my physical therapy via virtual visit.
The access to all the resources on campus, that is an ideal constellation of collaborative medicine and patient-centered approach. We are all working together to provide the best experience for patients. Sometimes they come with their wheelchair and they are able to return, walk in the clinic, and then go back to a normal life. Not everybody has a cardiovascular risk. However, if they feel that they have risk factors or if they have new symptoms, we encourage them to have a prompt referral to cardio-oncology.
It was tough being sick, and it is just so nice to be on the other side now. I am doing well, I have an active full life, and I have my cardiac issues under control.